You know, I have a very interesting life where I have one foot in the experimental laboratory, and then I also practice both ambulatory and inpatient cardiology, and actually quite seriously on both sides. And that gives me a pretty interesting perspective on what the future challenges are in atherosclerosis research and preventive cardiology. And I would say in my laboratory life, I'm surrounded by people who worship at the altar of mouse. I review papers every week. I review grants on a regular basis. And I go to endless meetings where people talk about atherosclerosis as if the mouse were the end-all and be-all of atherosclerosis research. But then, on the other side, I see the incredible complexity of the human disease on a regular basis. And I've written about this in a recent commentary in Circulation Research, but I think there's an enormous gap. Now, there's no reason that we shouldn't use the mouse as a wonderful experimental preparation that allows us to do precise genetic manipulations and test mechanistic hypotheses in vivo in a wonderfully controlled manner. But we must remain cognizant, and this is the challenge, that the mechanistic studies that we do in mice cannot be glibly translated to the clinical situation, and that we do so at our peril. So I think that the challenge is to make a synthesis between the precise, controlled mechanistic studies in the mouse, but always remain cognizant that there's an enormous gap between mousology and the human disease. And so I have a lot of fun trying to straddle that particular valley.